especially with the ongoing efforts on mainstreaming HIV and TB programs into the broader health system. This is especially because of the US government withdrawal of foreign aid and what we are doing as the Ministry of Health. And as we continue to navigate these complex health challenges, it is now becoming a stark reality that sector. Thank you for joining us today. I would really want to appreciate, first of all, His Excellency, the President of the Republic of Kenya, for the great support, the tremendous support we have received from the highest office of the land, and again, in terms of guidance and leadership. I also want to appreciate the work that the PSS, the DG, and the technical officers have done. They have worked endlessly without tiring to ensure that we continue with health service provision in Kenya. So we continue with our important updates to share regarding the ongoing health initiatives, the emerging health challenges, and the collective efforts that we are having to improve health service delivery in Kenya. And also this includes the continuity of essential health services, especially with the ongoing efforts on mainstreaming HIV and TB programs into the broader health system. This is especially because of the US government withdrawal of foreign aid and what we are doing as the Ministry of Health. And as we continue to navigate these complex health challenges, it is now becoming a stark reality that Taifa Care, that is universal health coverage, which is affordable, accessible, quality care to Kenyans, is really paramount at this time. For more than 40 years, we have been able to depend on partners. PEPFAR have done a great job in ensuring that HIV patients, the TB patients, are receiving health services, and we really acknowledge and appreciate the great work that they have done. We are really surpassing even the 95 goal that we have been given, with more than 3.7 million Kenyans being on HIV medications. But at this juncture, I believe that it is critical for us to think of sustainable solutions, domestic health financing, and part of it is through Taifa Care, and that is through the Social Health Authority, where we'll be having funding from the Social Health Insurance and also from Exchequer, and again, looking at Treasury and other alternative forms of funding to ensure that we are also looking into the concerns of HIV, TB cases, and also patients who have malaria or other forms of support that the US government has been offering us. So despite the global health challenges, we want to assure you that the government of Kenya, the Ministry of Health, is ensuring there is continuity of essential health services for all Kenyans, and including the HIV, TB, and other critical health services. So the importance of mainstreaming service delivery across the nation is really paramount for us, and we are continuing to do that, and we want to assure Kenyans that we are leaving no one behind. While in the NHIF, we only had a small proportion of Kenyans under the insurance cover, we are seeing that health service delivery is occurring so that we can have all Kenyans, no matter whether you're rich or poor, you can be able to access health service, which was not there before. And so be rest assured, this is something that we intend to achieve within the Ministry of Health. So with the emerging issues and the reorganization of health priorities, it is crucial that we avoid panicking. We need to be strong, and we acknowledge the role that the global parties have done, the World Health Organization, UNAIDS, etc., in terms of technical advice, in terms of leadership, and etc. But for us, it is time again to take charge of our health system. The withdrawal of funds is really calling upon us as Kenyans to see how we can have sustainability, how we can stand on our own feet, and how we can become self-reliant. So we had time and time again given policy direction on integration of HIV and TB management into the broader healthcare system, and this is becoming a stark reality that we really need to move towards that, so that we don't have HIV, TB programs standing in silos, but we have them integrated. And this is again part of the initiative to have one plan, one M&E, one budget. And you see, by that, we'll be able to secure so many resources that have been falling through the cracks over time immemorial because of fragmentation of various programs within the ministry. And so we are working towards that, and we want to assure you that we will have integration occurring in the coming months. We have had best practices from various counties like Murang'a, and so it's for other counties again to come up and ensure that we have integration of the programs. This not only involves resources, but again change management, behavioral management among our healthcare workers, leaders, among others, to ensure that we are having integration of the system. And then let us also be cognizant as Kenya that this is not just a Kenyan issue. It's not even an African issue. It's a global issue, and it's calling on us to strengthen our healthcare system in those levels. So it is not a crisis. It has been planned, and we've had long-term strategies as a ministry to ensure there's integration, there's continuity, sustainability, and domestic health financing. And again, our key direction, our clear policy direction is that integration of healthcare services is the way forward. HIV, TB programs, etc. need to be integrated. We need a one plan, one M&E, one budget, so that we can move forward. Again, for the counties, we are really calling again for their integration, sharing of best practices such as in Murang'a, their leadership, their informed decision making and community engagement to be improved. And again, we as the Ministry of Health want to assure that we will provide leadership and support and resources as well to ensure that our people are not left behind and each one of us is able to access services. And so let us build on the strengths and avoid unnecessary panic. Let us work together as a country so that we can ensure that we have healthcare service that is more inclusive, efficient, and sustainable, and have accessibility, affordability of quality care to all Kenyans. With those opening remarks, I would like to usher in the DG to give us the updates. Thank you.
Thank you, Madam Waziri.
Especially with the ongoing efforts on mainstreaming HIV and TB programs into the broader health system. This is especially because of the US government withdrawal of foreign aid and what we are doing as the Ministry of Health. And as we continue to navigate these complex health challenges, it is now becoming a stark reality that, especially with the ongoing efforts on mainstreaming HIV and TB programs into the broader health system. This is especially because of the US government withdrawal of foreign aid and what we are doing as the Ministry of Health. And as we continue to navigate these complex health challenges, it is now becoming a stark reality that